NCLEX review prep, I want you to know there's some topics that shows are based on what I've heard. These are commonly tested. What is the next best response? The nurse is caring for a client with new leukemia diagnosis who need chemotherapy urgently. 30 minutes before the infusion, the client said, I want to go home now. What is your response? Buzzword has been underlined. Case has been analyzed. Portion of acts is being circled, right? Best response. Diagnosis of leukemia. Before the infusion of chemotherapy that he needed urgently, he said, I want to go home. Therapeutic communication. Few words. Don't talk, let the patient talk. If you're talking, ask for more. Don't bring any reassurance or anything like that that you are not 100% sure of. Therefore, I will give you the AMA paper in a few minutes. That means leaving without medical advice. Okay? Is a patient is entitled to that, but is that therapeutic? No, that's not therapeutic. Don't be afraid. We will take care of you. How do you know that? Please tell me more why you want it. This is more convenience, giving you more information. You are not talking. There's nothing at home to help your situation. You are the one talking here. You talking. Don't be afraid. You talking. Yeah, I will give you the thing. You talking. Patient is talking. Tell me more. You're asking them to speak. That is the best answer. Okay, so I want you to master this information very well. Next question. A nurse is caring for a client who presents with exertional chest pain and prescribed morphine. The client asks the nurse about the purpose of the morphine. Which of the following is the best response? People coming to the emergency room, we all know the morphine, oxygen, nitro, aspirin, even though not everybody need oxygen, not everybody need all those information. We don't give it to everybody, but that's for your test. Just know that there's something called mana, but you have to know if patient saturation is 95 and above, you don't need oxygen. So it's all depend on patient. But why do we give them morphine? You have to know that. To decrease your oxygen demand, to help with pain associated with anxiety, it decreases your blood pressure, it decreases your respiratory rate. All of them is classic for morphine. Morphine can vasodilate you, it can decrease your blood pressure, it's a depressant, it can decrease your respiratory rate, it can help with pain, that take away your anxiety, it depresses your heart myocardial function, the demand, and that all are right. But what is the most important? In the patient, this is a prioritization in this, guys. In the patient who is having exertional chest pain, they having chest pain because they are exerting themselves. That's the word, exertional chest pain. If I decrease how much oxygen, basically demand from your heart, you're going to be perfect. So I prefer number one, to decrease your oxygen demand, the of your heart, basically, to improve your function. Okay, it does that. Even though the pain will decrease the anxiety, the heart is like you have a stroke. When you have a stroke, we don't want your heart or your brain to work too much. The same thing. If you have a heart attack, we don't want your heart to need too much oxygen, and therefore it's going to pump. It will ask for the heart to pump too much, and the heart that is defected get into trouble. So we want to decrease the oxygen demands, and so that you don't need too much oxygen, but you have enough to get you to where you're going. Okay. When the demand increases, supply has to increase. We don't want too much supply in the situation of chest pain. So one is better. Number three, a client presents to the emergency room with acute onset of what? Slurred speech, number one, arm drift, facial drooping, and weakness, a bunch of buzzwords. Which of the following the nurse know will contraindicate the use of Arthroplasty if indicated? I've given you everything you need to know. You can say, I have no clue. I give you Arthroplasty, something should be ringing in your ear. I give you slurred speech, facial, and it's an acute onset, and it's weakness. this is stroke, right? If this is stroke, I got to take care of you. We have to give you Arthroplasty. You have to know this medication. There's contraindication. You can give it to them if the symptoms is more than 4.5 hours. So it's been 5 hours. This is wrong. We can't give it to them, right? So this is correct. Symptoms onset, which of them is contraindicated? If the symptoms onset is more than 5, yeah, you can give it. If there is a mass in your brain, you cannot get it. If you have this, what we call AVM, it's basically the artery and the veins all joined together, it will let you bleed easily. If you have recent surgery, your surgery should be more than 3 months. If it's recent and it's 2 months, you can't get it. And if your blood pressure is uncontrolled, you can get it. So all of them are contraindications. So if this patient has all these features, he's not getting Arthroplasty. That is all. If you have all these of this, you're not getting Arthroplasty. Number 4. A nurse is caring for a client diagnosed with what? Gingival hyperplasia. You heard it before? Yeah, come. Which of the following ordered medication the nurse should question? Buzzword. Gingival hyperplasia. Which of these medication I should question? That means the medication either causes gingival hyperplasia or is contraindicated in patient with gingival hyperplasia. Today, we don't know. Most calcium channel blockers causes gingival hyperplasia. The number 1 is nifedipine. And the nifedipine is notorious. Among all calcium channel blockers, nifedipine is notorious in causing that. This is a calcium channel blocker. This is calcium channel blocker. This is calcium channel blocker. But this is number 1 among them. But you have to select them. You select or apply. They all have potential. Phenotime, yeah. It's an anti-seizure medication. One of the side effects is gingival hyperplasia, right? Azithromycin, what do you think? Is it contraindicated? Do you need to question? No. The treatment of gingival hyperplasia, you can give the antibiotic azithromycin to help with the dental crisis to prevent further decay. So you take care of the antibiotic load. So azithromycin is not contraindicated. Therefore, we don't have to select it. So which one should the nurse question? I'm not questioning a medication that can be used to treat the problem. So I'm not questioning it. 1 to 4 is your right answer. Number 5. A nurse is caring for a client diagnosed with gingival hyperplasia. The same concept. I just want you to master it in case they give it to you. I'm thinking about things they can ask you. Which of the following is indicated? All I'm trying to say, gingival hyperplasia indicated. When they give you a question like that, it means know everything about the gingival hyperplasia and look at the answer choice and see if it's a treatment, intervention, prevention, or anything, and then choose it, everything about it. Gingival hyperplasia. So, Bristol toothbrush. Yeah, that means I'm going to, because of the gum bleed that is going to happen, soft brush. So, this is indicated. Throat flossing. You got to do some flossing. That will help. Good flossing. Antiseptic, what? Mouthwash. Excellent. Salt and water raising is also good, and azithromycin will help with the bacterial load. So all of them is indicated. I'm just showing you how you can be treated, and the previous question talked about what causes them. So all of them is indicated. Number 6, a nurse is teaching the client prescribed warfarin due to prosthetic health. Which of the following need further teaching? Buzzwords. You have prosthetic valve, heart valve, you have warfarin. Which of these needs further teaching? I will need frequent lab draw. Yeah, warfarin, you have to have frequent lab draw. I will take this medication for 6 months. No, it's for the life. Why? Because you have prosthetic valve. So for life. Right? So the question say need further teaching, right? I will avoid vitamin K in diet. You don't need to avoid vitamin K. You need to eat whatever you eat. If you're already eating it, yeah, but don't avoid it. When you avoid it, you're likely more to bleed. If you eat vitamin K, if you eat 2, you have the word is consistent. I'm going to have consistent intake of vitamin K. if I already eat it. But if you avoid it totally, it's a problem, because then tomorrow when you go and eat it, it becomes a problem. But when you're eating it and you're taking warfarin, then warfarin will know how much to titrate your warfarin to take care of it, so that whatever you're eating, we're subtracting it from it. So you shouldn't avoid it. This is a wrong answer. I will limit intake of freshy what? Leafy vegetables. This is the same thing. Number 3 and 4 are the same thing. You should not limit. You should stay the same. I will maintain, you see, the usual amount of vitamin K intake. So this is good. Therefore, need for further teaching is 3, no, 2, 3, and 4 all need further teaching. 1 is fine. It does not need further teaching. 5 does not need further teaching. So 2, 3, and 4 are your answers. It's a selector apply. You don't have to pick anything. In the new generation, don't pick everything. If you're confident, pick it. If you're not confident, don't pick it. Number 7. What is the problem? Which of the following teachings appropriate? A nurse is caring for a client with diabetes on metformin. Now prescribe metoprolol for heart palpitation. There's a reason why I underline all this thing. I put the word now. When you're reading a question, something should be triggering in your mind and say, hey, no, this is a test-taking strategy. They tell me patient has diabetes, he's on metformin, and now they give them metoprolol. Think about it. Is there a coloration? Yeah, metoprolol is a beta, okay, antagonist, right? It's a beta blocker. Beta blocker, what do? They can stimulate, increase your sugar level, very, very notorious in increasing sugar level. And so what are you going to do? Your sugar goes up. If your sugar goes up, what is going to happen? I will need metformin dose to be decreased. No, you need to go up on it. I will need metformin dose to stay the same. You need to go up on it. I will need metformin dose to be increased further, and I will need the metformin dose to be halved. No, so we got to go up on it. So beta blockers are not good in diabetes patients. They may need, you have to adjust their sugar. Okay. And this is caring for a client with small bowel obstruction and receiving NG tube decompression for 3 days. Which of the following lab abnormality the nurse should monitor? Look, when somebody has NG tube in place, okay, think about it. NG tube is sucking an acid from your stomach. You have to know this lab work. They love it. Every time they give you pylori stenosis, this is the dehydration. It's sucking all the acid. Therefore, you're going to be alkaloid. So you have metabolic alkalosis. Therefore, this is wrong, right? You cannot monitor that. And I'm removing all the sodium chloride in your stomach. So I'm removing it. Your sodium go down. So you're not going to be hypernatremia. As your stomach sodium go down, your kidney absorb sodium, and then it lower your potassium. So you're going to be hypokalemic. You see, so the metabolic problem is you get metabolic alkalosis, right? And you get what? Hypo, sodium is low, potassium is low. So metabolic alkalosis, how do you correct it? Your body will do respiratory acidosis. So respiratory acidosis. PCO2 of 48 is respiratory acidosis. So you need to monitor for that to tell them that your lab work is being corrected. We prevent this by giving you a lot of fluid. So this is why patient come in vomiting, and we want to prevent metabolic alkalosis, hyponatremia, hypokalemia by giving you fluid. So the right answer is number 4. It's a little bit test-taking strategy thinking. And the last one. Which of the following statement need further teaching? A nurse is teaching a client post-total hip arthroplasty at discharge. Watch for the word. This is the same as hip replacement. It's different from arthroscopy. Scopy, if I put scopy, means I'm looking inside the knee. I'm not replacing it. Look for the word plasty, means a new replacement. So whenever you have a hip replacement, that means you have a prosthetic new one. The problem is we don't want you to flex okay, more than 90 degrees, and then bend, right? And bring the two, we don't want you to bring the two legs together. We want you to keep them apart. Because of that, you got to use high toilet seat so that you don't have to bend more than 90 degrees. You don't need to cross your legs so that you're going to fall. You bring the two legs together. That is a deduction. No leg cross. Use of hand assistive device. Like if you have to wear your shoe, you don't have to bend. You can use something shoe on to put your shoe on easily, right? You got to do glute exercise to improve your glute muscles using isometric to build the hip strength. Okay, this is to say wheelchair. Use wheelchair daily. You can use wheelchair because you have to be walking before coming out of the hospital. And therefore, if you're using wheelchair, yeah, this will need further teaching. So which one need further teaching? It's only number 5. So only number 5 is the answer. I know I select check, check, check. What I mean is this is correct. So there's no need further teaching. 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 The only thing that need further teaching is the use of, this should have said wheelchair. You shouldn't use wheelchair daily. You should be walking. So 5 is the wrong answer. This is the end of it. Thank you. Enjoy. All the best of luck. Good luck.